Hello, my name is Kyle Richardson, and I am providing a debrief on the Hantavirus. The Hantavirus is commonly found in Europe, Asia, and North America, but the most common strain in North America is the sin nombre virus, which is hosted by deer mice. It's vector-borne, and it causes pulmonary or liver failure. It's not spread between humans, so that'll be a consideration later on. The people at highest risk are anybody occupied in locations with potential for rodent exposure. For example, warehouses, especially food warehouses, or living in rural areas. American Indian women ages 40 to 64 are at higher risk. And anybody who develops symptoms with recent known exposure to mouse excrements are at high risk. This strain of hantavirus in North America was first identified in the Four Corners region of the United States in 1993. So that's where Utah, Colorado, Arizona, and New Mexico meet. There's a rapid test that can quickly identify antibodies of hantavirus, but even with a rapid test, a confirmation test is required. And that confirmation testing happens in a clinical setting, such as a hospital, a provider, or a lab. They draw a blood specimen, and that gets sent to an external lab for testing. The average incubation period for hantavirus is 2 to 3 weeks. So you either have exposure 2 to 3 weeks before symptom onset, and then with symptoms, you should get testing and manage symptoms. If somebody's tested within 72 hours of symptom onset, that test has a higher chance of showing negative, even if they do have hantavirus. So it's recommended with symptoms to get retested after that initial 72 hours. Hantavirus can cause hantavirus pulmonary syndrome. It can also cause liver failure, but that's more common in some of the strains that are more common in Europe and Asia. So in North America, we have the pulmonary syndrome as the most common symptom, and death can occur really rapidly. So 1 to 2 days after cardiopulmonary symptoms start, death can occur. Initial symptoms can be hard to miss because they're similar to the flu. And since its discovery in 1993, 850 cases of this particular strain of hantavirus have been reported in North America with a 35% fatality rate. So that high fatality rate is one of the reasons why this is such a concerning disease. Prevention includes ventilating rooms prior to cleaning them, wearing gloves when cleaning rodent excrement, and disinfecting surfaces where rodent excrement has been. And that disinfection should happen with wiping up the mess. You want to avoid stirring up dust through sweeping and vacuuming. So wiping up is the best practice. Thank you.